Hi, welcome to our last Fall Prevention Month lunchtime talk. This month, we started off by looking at different environmental factors which can affect risk for falls. So for example, winter conditions. Then we moved on and looked into different factors that link to the individual, which could influence risk for falls. So for example, having depression or diabetes, hearing loss, how those different conditions affect falling. And then finally, we looked at different interventions which can help reduce your risk for falls. So we learned about exercise. We also learned about a Balance Pro insole, which can help reduce falls. Today we have a physiotherapist and an occupational therapist here with us to share some tips to prevent falls. So we have Carmen and Amanda here with us from St. Elizabeth. So I'll pass it on to them.
Thank you. So today we're going to talk about some very general tips on fall prevention, and we're going to give a quick overview of everything that has been talked of this week. So what do we know about falling? We know that everyone is at risk of falls, and as we age, this risk increases, and also the risk for injury increases with that. Common types of falls and reasons for falling are slips and trips, falls on stairs, or falls off furniture. These falls lead to more than 50% of emergency room visits and hospital admissions for people 65 and older. So what are some risk factors for falling? And we categorize them in 4 domains: behavioral, biological, socio-economical, and environmental. So behavioral, what is that? It's more fear of falling, people carrying items on the stairs, not using handrails, being physically inactive, rushing to the bathroom at nighttime, rushing to answer the phone, wearing clothing that can be tripping hazards, long skirts or hanging scarves. And all these, or having footwear that's unsafe. Biological factors are more to do with your physical function. You can have conditions such as arthritis, history of stroke, dizziness, balance issues, vision problems, hearing loss, cognitive issues, recent illnesses, incontinence, and sometimes just the aging factor. It's a big risk of falling. Socio-economical factors, it's relates to the ability of getting the recommended equipment due to financial resources, or culture sometimes influences whether or not people want to use a walker or a cane because it's not culturally appropriate. Environmental factors, physical environment, both indoors and outdoors, winter, unsafe floor coverings, slippery surfaces, clutter, throw rugs in the home, lack of grab bars, and unsafe walkways outdoors, or no railings. So what can you do about your risk of falling? So as we said, everybody is at risk of falling. So if you identify that you are possibly at the risk of falls, you want to have a screening process done to see if you are at risk. If you are at risk of falling, then the next step would be a comprehensive assessment done by a health professional. That would include a physical assessment, environmental assessment, and functional assessment. After that, appropriate interventions based on the individual assessment. There are multiple factors that lead to a fall, so really need to get to the root cause of what constitutes a fall risk. Oops. So the interventions have to be individualized and specific to your needs. They need to be multifactorial, looking at all the factors that might cause you to be at high risk of falling, and also to be centered around your particular needs, and also what your goals are. That's very important as well. Exercise is one of the indications for everybody, not only for people who is at risk of falling. And as we know, there are a lot of benefits to exercise. It builds muscle strength through strength training. It prevents falls by doing challenging exercise balances. The other way, challenging exercise, balance exercise. And exercise also prevents the rate of bone loss, which leads to osteoporosis. And in the event of a fall in people who have osteoporosis, can lead to significant injury, hip fractures, and also death in a lot of cases. So how much to exercise? These are the American guidelines from the College of Physical Medicine. And the recommendations are at least twice a week to do strength training to address your upper body, your arms, legs, chest, shoulders, and back. And for each exercise to do at least 8 to 12 repetitions. Balance exercises to do every day. Some sort of balance exercise that can be a Tai Chi program, dancing, or just simply walking or on your toes and heels. That really challenges your balance. And then aerobic physical activity. Cumulative 150 minutes per week. It's the recommended time. And to do it in bouts of 10 minutes or more of moderate to vigorous intensity of exercise. And certainly if you do have concerns about safety when you exercise, you need to consult a physiotherapist or a kinesiologist for exercise prescriptions that is tailored to your needs. Tips for safe exercising. To exercise 5 times a week or more, to work to a moderate to vigorous level of difficulty. And what that means, on a scale of 0 to 10, where 0 is very, very light and 10 it's extremely hard, you want to be at a level of 5 to 8. Moderate intensity, it's 5 to 6, where you can walk and talk in the same time, but not sing. And vigorous activity, it's at a level of 7 to 8, where you can say a few words, but you need to catch up. It's not that easy. Additional tips, if you're new to exercise, start at a low to moderate intensity for 10 minutes at a time. Choose exercises that are appropriate for your fitness level, abilities, and health. Make an exercise plan. Keep an activity log and stick to your plan. And now I'll turn it over to Amanda for home safety tips.
Great. So you need to identify items that may lead to a slip, trip, or fall within or around your home. And some possible changes that you can make to decrease the fall risk can be put into 4 categories. So the first is to remove hazards in the home. So this may include creating clear pathways within the home, rearranging furniture so that you can walk around without having anything in the way, removing scatter mats or cords that may cause a tripping hazard, or repairing any wrinkles or damaged flooring. The second would be to add support features like installing grab bars or handrails, or putting additional lighting in around the home. The third is how you move or complete activities. So making sure that if you do have the handrails or grab bars, that you're using them in the home, that you turn on lights when you're entering into the room, and that you're not putting items on the floor that could lead to clutter pathways. And the fourth is looking at possible adaptive equipment that may help to increase your safety at home. So this could be like adding a bath seat into the shower, adding a riser to the toilet, or a bed rail near the bed. And then we just have a short video to share. You got it? Thank you. Yep.
Hello, welcome to Healthcare with St. Elizabeth. We're here at the George Brown Home Safety Lab. In this video, we're going to be talking about making your home a safe place for older adults. It's never too early to start thinking about these things, as most Canadians say they would like to live at home for as long as possible. The #1 cause of injury for older Canadians is falling down. 1.4 million seniors fall each year, and these falls often lead to the transition into long-term care. These falls can result from health conditions, side effects from medication, and social isolation. But the #1 cause are slips and falls on stairs and ice and snow. To make your home a safer place, we'd like to show you how to start creating an aging-friendly home. We'll show some key elements here, but for a full list, go to stelizabeth.com or call us at 1-855-275-3549. First, we'll address some safety measures outside the home. Make sure you have sturdy handrails. They significantly increase your ability to recover from a loss of balance. The rail should be comfortable enough for you to grasp and high enough off the ground for you to stabilize yourself should you lose your balance. We recommend 38 inches from the ground. Your walkways need to be even and clear of ice and snow during the winter. If you're unable to climb stairs, a ramp or a porch lift can help you enter your home. Now let's have a look inside the home. Make sure to clear pathways of extension cords or any other tripping hazards. Remove mats or tape them to the floor. Install sturdy banisters on both sides of the stairs. Install bright lights and night lights in bathrooms, hallways, and near stairs. These will help you see where you're going and avoid any other hazards. The bathroom is another place where we need to think about safety. You might want to install a raised toilet seat so you don't have to bend too low. In the shower or bath, you might want to install grip bars to help you get in and out of the tub. You can also install a colored bath mat to increase depth perception and to keep you from slipping. If you're still worried about slipping in the shower, use a safety seat while bathing. Use a handheld shower head for rinsing and hair washing to limit movement and lower your chances of slipping. If you make some simple changes around your house, you can create an aging-friendly environment that will allow you to live at home for as long as possible. So take some time to look around your home and think about what you can do to make it safer. For more information, visit stelizabeth.com or call us at 1-855-275-3549.
Okay. That's right. And I'll just start talking. So a few more factors to consider is safety in the community. So fall hazards in the community are unpredictable. So we need to try to plan ahead as much as possible. Ensure to scan the environment for possible risk factors. This may be if you're going out and you know you need an accessible bathroom or entrance. Maybe, yeah. Oh, is that better? Yeah, that's perfect. Yeah, so just making sure that if you need like an accessible entrance or bathroom, then just calling ahead to see if it's available where you're going. If you're visiting friends, then just asking for a tour of their home so that you can potentially identify any potential risk or hazards, or just become more familiar with their environment because it's not your home that you're used to. The other is feet, to take a look at your feet, footwear, and clothing. So with your feet, you want to protect your feet because that's what you use for your mobility. So doing daily inspections of your feet, just make sure that there's no sores or calluses or blisters. And if there is anything that you identify, following up with your physician as appropriate, and making sure you take care of your feet, getting your toenails cut. And if you're unable to, then connecting with a healthcare professional who specializes in cutting nails. Footwear is also really important. It's important to have well-fitting, supportive footwear, both indoors and outdoors, to have slip-resistant soles, and to make sure that you're not walking around the house in slippers, bare feet, or stocking feet, which could also potentially lead to a fall. And then we've talked about clothing, but just avoiding any loose articles of clothing. If you have like a long robe or house coat, you could potentially slip on that, or wearing clothes with baggy pockets can get caught on door handles. So it's important just to manage your health. So scheduling regular checkups with your physician. And if you have any questions about any of the risk factors that you may have identified for yourself, then following up with someone on your healthcare team. And they can always help point you in the right direction if it's not within their scope of practice. Staying active both mentally and physically, ensuring that you have proper nutrition and hydration. And ensure caution when changing positions after sitting or laying for more than 20 minutes. It's important to sit at the side of the bed or in your chair for a few minutes. And then when you stand, you want to pause, count to 10, take a deep breath, and then take your first step. And this is really important, especially at night when you've been laying down for a while, if you have to get up to go to the bathroom. Medications is also very important, but just to review your medications with your physician and or pharmacist. Just being on over 4 medication increases your risk for falls, and sometimes there's side effects of medication that can also have a risk for falling. So it's important to plan ahead. No one plans to have a fall, but it's important to know what to do if you do have a fall. So if you are aware, so you need to be aware of what to do if you have a fall and have practiced getting up from a fall. Then you'll feel more confident and have less fear of falling. So we just have one more video to share, and then we'll wrap up.
How to safely get up from a fall. Precautions. If you are injured or are in pain, do not get up, as you may have an injury or fall again. Call for help by either making noise, using an emergency alert system, or using a phone call to call 911 if within safe reach. How to get up from a fall. If you are not injured, then the following steps can be used to get up from a fall. Roll onto your side. Get onto all fours. Rest for a minute. Crawl to the nearest stable, chair, or couch. Place both hands on the chair or couch for support. Bring your strongest leg up so your foot is flat on the floor and you are kneeling on your other knee. Lean forward onto the chair or couch and stand so you are weight bearing through your strong leg. Once you are standing, turn and slowly sit down and have a rest. Let someone like your family member, friend, or neighbor know you have had a fall. Try to remember what happened before you fell. Were you dizzy or lightheaded? Did you have chest pains? Did you trip? Did you have a problem with your walker or other equipment? Tell the details of your fall to your family member or friend or neighbor you trust and to your healthcare provider.
Okay.
Thank you for listening to us. Do you have any questions?
Okay, if no one has any questions, I'll wrap it up. Thank you so much, Amanda and Carmen, for sharing those tips with us. I think that was a great way to end the month. Touched on a number of topics that we've already have videos on. So if you missed any of the talks, feel free to look at them on YouTube. There's a tour happening right after this talk, so feel free to stay for that. And I guess I'll see you next year, maybe. Thank you.